Hello, everyone, and welcome to the Diabetic Toolbox, where we are on a mission to end type 2 diabetes one family at a time through education, support, and empowerment. If this is our first time meeting, my name is Renee. I am an emotional eating and diabetes lifestyle coach and a yoga teacher, and I help folks over 40 diagnosed with prediabetes or type 2 diabetes to lower their blood sugar, lose weight, and increase their mobility without spending hours in the gym or feeling like they have to give up everything they enjoy. Today is part 2 of the Men's Diabetes Blueprint series, and we are talking about something I never thought we would talk about here at the Diabetic Toolbox. But this is the reality of diabetes. It affects every part of your physical and emotional health. Today, we're talking about erectile dysfunction. And I want to start by saying that this is important because erectile dysfunction is not just about sex. It is often one of the first warning signs that something is going on in your body that needs your attention. And for a lot of men, this is not an easy topic to talk about. It is private, it can feel embarrassing, it can affect confidence in a very, very deep way. So instead of talking about it, a lot of men try to ignore it or look for a quick fix. But what if this is not just a moment to fix something? What if this is your body trying to get your attention? So let's talk about what's really happening. An erection depends on healthy blood flow and strong nerve signals. When blood sugar levels stay elevated, both of these systems can be affected. First, blood flow. High blood sugar can damage the lining of your blood vessels, making it harder for them to expand and deliver blood where it needs to go. And here's something that a lot of people do not realize. The blood vessels involved in erectile function are smaller than the ones connected to your heart. So when there is a problem with circulation, it often shows up there first, which means that erectile dysfunction, or ED, can appear years before heart disease is diagnosed. So let's talk about nerve health. We know that high blood sugar can damage your nerves, and they damage the nerves that carry signals between your brain and your body. These signals are essential for arousal and response. When those pathways are affected, the communication between the brain and the body is not as strong or as clear. So what you're dealing with is not just one issue, it is blood flow and nerve function working together, or in this case, not working the way they should. And beyond the physical side, we know that there is an emotional layer that cannot be ignored. ED can impact how a man sees himself. It can affect their confidence. It can create distance in relationships, especially when it's not talked about openly. There can be frustration, silence, even misunderstanding between partners. And all of that adds up to another level of stress, which does not help the body either. Here's where everything connects. What we talk about in part 1, knowing your numbers, they all play a role here. So, knowing your blood sugar levels, your blood pressure, your cholesterol level, your waist circumference, when those are not where they need to be, your body is under stress. And ED can be one of the first visible signs of that stress. This is not a random occurrence. It is connected. So, this is your invitation to look at this differently. Not with embarrassment, but with awareness. If this is something that you are experiencing or someone you love is experiencing, it's worth having a conversation with your healthcare provider. It's worth getting your numbers checked. It's worth asking questions and understanding what your body is trying to communicate with you. That is the thing about our bodies, folks. Our bodies are always communicating, always telling us what it needs and what it doesn't need. We just have to be more in tune so that we can respond to what it's trying to tell us. And if you are supporting someone through this, approach it with care. This is not just physical, this is emotional and it's personal. So it's so important that we create space where this can be talked about without judgment, because this is the only way that we're going to be able to make a difference. Now, if you've been listening to this and thinking, okay, this makes sense, I do need to get my blood sugar under control, but I don't know how to actually do this day to day. Knowing what to do is one thing, but doing it is something completely different, especially when it comes to dealing with cravings, habits, and a busy life. That's where folks get stuck. And that is exactly why I created my 4-week emotional eating and blood sugar reset coaching program. If you are someone over 40 and you've been diagnosed with type 2 diabetes and you're tired of trying to figure out what to eat, tired of dealing with cravings or watching your blood sugar stay higher than you would like, join the program. Inside of it, I will walk you step by step through a simple, realistic plan that is going to help you to lower your numbers, lose weight, and feel more in control of your eating without going to the extreme or starting over again on Monday. You can join us by clicking the link in the show notes. We start on May 31st. And listen, guys, there are only 20 spots available. I keep the coaching program small so that I am able to give you all the attention that you need. As we close out today, I want to leave you with this. ED is often treated like something to fix quickly and move past, but it is really a signal. It's a message from your body asking you to pay attention. When you listen to that signal early, you give yourself the opportunity to support your health in a deeper and more satisfying way. This is about your heart, your circulation, your energy, your relationships, your life. All right, my friends, that is all I have for you today. Please share this episode with someone you love. Check out the coaching program, our 4-week program. You can click the link in the show notes for more information and to grab your spot. And join me tomorrow because our focus continues on men's health. If you have not subscribed to the podcast or followed the blog, please do so you don't miss an episode. I will talk to you tomorrow. Have a beautiful day.